I have had a complete hysterectomy and I'm on hormone medication. I'm dealing with weight gain. What do I recommend? Antoinette Bustle. Okay, Antoinette, with a complete hysterectomy, that means the uterus and usually the ovaries too, sometimes one, sometimes both ovaries. That means you need hormone replacement therapy. But there are two ways to do this. The traditional way makes you gain weight, amongst other things. But there's a new technology called bioidentical hormone replacement, a BHRT. This is what I recommend for everyone. If you had hysterectomy, if you're just middle aged and you're going through menopause for women, menopause for men, you need bioidentical hormone replacement therapy. Just Google BHRT in your area. Providers, there are doctors doing this everywhere. I do this in my office. I have patients that fly in from Detroit, Chicago, New York, Florida to get this technology, but it's available in a lot of places. You don't have to go through all those changes to do it, and it will be life changing. Just as the hysterectomy changed your life, this can change your life back to no weight gain or weight loss, increased sex drive. Your vagina is no longer dry and thin; it becomes thick and moist and ready to receive. Your libido is markedly increased, and so you not only you want to have sex, you enjoy sex. You have more enthusiastic orgasms, if you will, that are stronger, harder, and feel better. All of these things. You sleep better. You don't have hot flashes. Just great. You go back to not only just being normal, but going back to being the way you were when you were 20 years younger. So again, the way that you want to feel, bioidentical hormone replacement therapy.